As a brain doctor, I'm shocked. This routine test raises stroke risk overnight. Every year, millions of Americans over 60 head to the hospital for routine checkups. We believe this is the best way to protect our health, to reassure ourselves that everything inside is working fine. You probably feel the same, right? You follow your doctor's advice, comply with every instruction, and hope the results will help prevent illness. But have you ever wondered, could some of these seemingly harmless tests actually bring new risks, even triggering a stroke overnight? It sounds hard to believe, but research has raised the alarm. Certain procedures, when performed on a body past 60, can trigger sudden changes, blood pressure spikes, irregular heart rhythms, and even short interruptions in blood flow to the brain. And these silent shifts can be the very sparks that ignite a stroke, a life-altering event that can steal your memory, your independence, and your joy of living. Picture this. You walk out of the clinic with normal results. You sigh in relief, maybe even celebrate with your family. Yet just a day or two later, your body sends strange signals: dizziness, blurred vision, a crooked smile, or weakness in your arms or legs. At the hospital, the doctor tells you you just had a mild stroke. And you ask yourself, how? I had no warning signs at all. The answer may lie in the very tests we take for granted. A single injection of contrast dye, a round of anesthesia during an endoscopy, or a stress test on the treadmill. Things that might be routine for younger patients can be risky for aging hearts and blood vessels. Now, this video isn't meant to frighten you, but to give you the right knowledge and the right questions to ask. After 60, good health isn't just about early detection of disease, it's also about knowing how to avoid dangerous hidden procedures we assume are safe. In the next few minutes, we'll uncover 5 common tests that may carry hidden risks, starting with the CT scan that uses contrast dye. If you've ever had a CT scan, you probably remember that strange sensation when the doctor injected the dye into your vein. A sudden wave of heat rushed through your body, leaving you both surprised and uneasy. The doctor smiled and reassured you, "Don't worry, that's completely normal." And it's true. CT scans with contrast are one of the great tools of modern medicine. They allow doctors to see blood vessels in detail, detect the tiniest tumors, and catch dangerous conditions early enough to save lives. But like a double-edged sword, this imaging dye also carries risks most people never hear about, especially after 60.
Did you know contrast dye can alter how your heart and blood vessels react in just minutes? In some people, it causes a sudden drop in blood pressure and a dangerously slow heart rate. You may feel dizzy, nauseous, or even faint right there on the table. In others, it does the opposite. Blood pressure surges, vessels tighten, almost as if an electrical shock ran through the circulatory system. And when that happens, the risk of stroke or heart complications can suddenly appear, even if it only lasts for a moment. A study published in the Journal of Vascular and Interventional Radiology found that adults over 65 with a history of high blood pressure, heart disease, or kidney problems faced a much higher risk of vascular complications within 72 hours of receiving contrast dye during a CT scan. It may sound rare, but when you add up the millions of scans performed each year, the number of people affected is no longer small. I'll never forget the story of Mr. Robert, an 81-year-old from Florida. He had only mild abdominal discomfort, and his doctor suggested a CT scan to rule out a possible tumor. The scan went smoothly, and the results came back clear. Relieved, Robert went home feeling safe. But just 2 days later, while having breakfast with his wife, his right arm suddenly went numb, his mouth drooped, and his words slurred. The hospital's diagnosis? A minor stroke. Doctors suspected the contrast dye may have temporarily raised his blood pressure, allowing a tiny clot to block a vessel in his brain. Fortunately, Robert regained most of his function, but the memory of that scare has stayed with his family ever since. Does this mean you should avoid CT scans with contrast dye altogether? No. The truth is, in many cases, this test can save your life. It can detect hidden tumors, bulging blood vessels that could rupture at any time, or dangerous clots before they strike. The real question isn't, should I have it or not, but rather, when is it truly necessary? So what can you do to protect yourself? First, never hesitate to ask your doctor, is this test really necessary for my condition, or is it just precautionary? In many situations, a non-contrast CT or even an ultrasound may provide enough information without added risk. Second, always share your full medical history: high blood pressure, kidney disease, heart conditions, or any unusual reactions you've had to medications in the past. These details help your doctor weigh the risks more carefully before prescribing contrast. Third, ask, is there a way to do this test without using contrast? You may be surprised to hear that sometimes the answer is yes. You see, a CT scan with contrast isn't your enemy. Think of it as a powerful ally, one that must be approached with wisdom and caution. After 60, wisdom often means asking the right questions and not accepting every procedure just because it's considered routine.
And now, after understanding the hidden risks of CT scans, let's move on to the second test, a procedure that sounds simple but carries more risks than most people realize: the treadmill stress test. Imagine walking into a cardiology clinic. The doctor says, "We'll run a stress test just to make sure your heart is doing fine." It sounds reasonable. Electrodes are attached, your heartbeat is monitored, and you step onto the treadmill. At first, it's just a slow walk, but then the speed increases, the incline rises, your heart starts pounding, your breathing grows heavier, and the doctor carefully watches the screen. You think, I'm doing the right thing for my health. But what many don't know is that this test can be a real shock to the cardiovascular system, especially once you're past 60. For younger, healthy people, a temporary rise in heart rate and blood pressure during exertion is no big deal. But for older adults, especially those with high blood pressure, heart disease, or blood vessels already weakened by age, a stress test can be like striking a match in a pile of dry straw. The sudden changes in blood pressure, heart rhythm, or even unexpected arrhythmias can trigger serious complications, from chest pain to an increased risk of stroke. A 2020 study published in the American Journal of Cardiology followed more than 1,300 patients over 65 undergoing stress tests. The findings were sobering. Nearly 7% experienced complications during the test, including sudden spikes in blood pressure, dangerous arrhythmias, and even small vessel injuries in the brain. 7% may not sound huge, but think of it this way. Out of every 100 people, 7 encountered trouble right on the treadmill. That's not rare, it's significant. Take the story of Margaret, a 74-year-old from Ohio. She had lived with high blood pressure for years, but stayed active, doing her own shopping and tending to the flowers in her backyard. When her doctor suggested a stress test just to be safe, she agreed. Halfway through the treadmill, Margaret began to feel dizzy and developed chest pain. The test was stopped and she was allowed to rest. But the very next day, she suffered a mild stroke. Doctors believed the surge in blood pressure during exertion caused a tiny vessel in her brain to rupture. Margaret was fortunate to recover, but her story serves as a sharp reminder: extra testing isn't always the safest choice. The important thing to remember is that a stress test isn't always dangerous. In fact, it can be life-saving for people who have clear warning signs: chest pain, shortness of breath, or unusual fatigue. But for those without symptoms, especially after 60, doing a stress test just to be sure can place unnecessary strain on the heart.
So what should you do if your doctor recommends a stress test? First, ask, is there a safer alternative for someone my age? In many cases, doctors may suggest a nuclear stress test, where medication simulates exercise instead of making you run, or an echocardiogram at rest, options that can be gentler on an aging heart. Second, be completely honest about your health history: high blood pressure, heart disease, or any symptoms you've experienced. Don't dismiss small details. Sometimes those details determine which test is truly safe for you. Finally, remember that you have the right to decline or postpone a test if it doesn't feel necessary. Your health doesn't depend on doing as many tests as possible. It depends on choosing the right test at the right time with the right precautions. A stress test can open a window into your heart, but after 60, it can also be a doorway to risks you don't need. Wisdom means knowing when to step onto the treadmill and when to choose a safer path instead. And now, after learning the hidden risks of stress tests, let's move on to another familiar procedure, endoscopy with sedation. A test that seems to be just about checking the stomach or colon, yet for older adults, it carries risks you may not expect. Endoscopy has become one of the most common procedures after age 60. Doctors often recommend it. You should have regular endoscopies to check your esophagus, stomach, or colon to catch cancer or polyps early. It sounds perfectly reasonable. Who wouldn't want reassurance that their digestive system is healthy? You go to the hospital, receive a sedative, drift into a short sleep, and wake up when it's all done. It feels easy, but behind that smooth experience are silent changes in the body that many patients are never warned about. In younger adults, short-term sedation rarely causes problems. But after 60, the body reacts differently. When sedatives enter the bloodstream, blood pressure and heart rate can drop. Circulation to the brain slows. And if you're taking blood thinners, like aspirin, warfarin, or Plavix, the situation becomes even more complicated. Just a small mix of low blood pressure and altered clotting can allow a clot to form and travel to the brain, triggering a silent stroke that no one sees coming. A large 2021 study, published in Gastrointestinal Endoscopy, followed thousands of patients over 65 who underwent endoscopy with sedation. The results were striking. The rate of transient ischemic attacks, TIAs, mini-strokes, within 72 hours was significantly higher compared to those who had endoscopy without sedation. These episodes often leave no permanent damage, but they are warning signs that the brain has been affected by changes in circulation.
Take the story of Linda, a 76-year-old from California. She was in good health with no symptoms at all, but her doctor recommended a colonoscopy just to be sure, since it was time. She agreed. The procedure went smoothly and the results were clear, but 2 days later, Linda began slurring her speech and walking unsteadily. Her family rushed her to the ER, where doctors confirmed she had suffered a mild stroke. The likely cause? A drop in blood pressure from sedation combined with her daily aspirin use, which allowed a clot to reach her brain. Linda recovered, but the fear left her determined never to undergo a just-in-case endoscopy again. This doesn't mean all endoscopies are dangerous. In many cases, they're necessary to detect and treat serious problems early. But the biggest risk lies here. Many people agree to the procedure even when they have no symptoms, simply because it's time or the doctor recommended it for reassurance. For a body over 60, that small decision can sometimes trigger a serious complication. If your doctor suggests an endoscopy, the first thing to do is ask, why do I need this now? Do I have specific symptoms, or is this just routine? If the only answer is just to be sure, it's worth reconsidering. Second, always remind your doctor about the medications you're taking, especially blood thinners. In many cases, doctors will ask you to pause these drugs for a few days before the procedure, but this step isn't always handled carefully. Third, ask about alternatives. In some cases, monitoring with stool tests, unsedated endoscopy, or using a lower dose of sedative may be possible. You can and should ask your doctor to explain the risks of each option instead of settling for a quick reassurance that it's safe, don't worry. Endoscopy with sedation may feel like a harmless short nap, but for older adults, it's during that nap that silent changes can occur. And when you wake up, not everyone returns to the same health they had before the procedure. Don't let just to be sure turn into an unnecessary risk. Wisdom lies in knowing when the procedure is truly needed and when it can be delayed or replaced with something safer. After the stress test, another common procedure is the MRI with contrast. It's one of the most advanced diagnostic tools in modern medicine, but when paired with a heavy metal called gadolinium, it can leave lasting effects on your brain and kidneys.
MRI is often hailed as one of the great breakthroughs in medical science. It allows doctors to look deep into the brain, spinal cord, joints, and blood vessels without surgery. With its precision, MRI has saved countless lives by detecting tumors, aneurysms, or nerve damage at an early stage. But behind that impressive picture lies a small detail many overlook. The contrast dye contains gadolinium, a heavy metal that can linger in the body, posing particular risks for older adults. When gadolinium is injected into the bloodstream, it sharpens the MRI images, helping doctors distinguish between healthy tissue and areas of concern. The problem is, after 60, our kidneys don't function as efficiently as they once did. The kidneys act as the body's filter, responsible for clearing gadolinium out. If kidney function is weak or slowed, this metal can accumulate, settling in the skin, muscles, and even the brain. In some cases, gadolinium buildup has led to a rare but serious condition called nephrogenic systemic fibrosis, or NSF. Patients may develop hardened skin, painful joints, breathing difficulties, and in severe cases, multi-organ damage. Even more concerning, recent studies have discovered traces of gadolinium in the brains of patients who had contrast MRIs, raising fears it could affect memory, focus, and even trigger dizziness or brief confusion, especially in those already dealing with vascular issues. A 2019 study published in Radiology tracked more than 2,000 patients over 65 who underwent MRIs with contrast. Within just 1 week, about 5% reported stroke-like symptoms, headaches, blurred vision, and loss of balance. While most did not suffer permanent damage, these warning signs make it clear gadolinium is not as harmless as many assume. I still remember the story of Harold, a 79-year-old veteran from Arizona. He suffered from chronic back pain, and his doctor recommended an MRI to find the cause. To be thorough, they decided to use contrast dye. What Harold didn't know was that his kidneys were already at stage 3 chronic kidney disease. 2 days after the scan, he began to feel dizzy, weak, and confused. The symptoms lasted nearly a week before doctors discovered the reason. Harold later said with regret, "If only someone had reminded me to check my kidney function first." Does this mean you should refuse all MRIs with contrast? Not necessarily. MRI, even with gadolinium, remains an incredibly valuable diagnostic tool. But the key is this: it should only be used when truly necessary and with the right preparation.
So, what should you do if your doctor suggests an MRI with contrast? The first step is to ask, can we do the scan without contrast? In many cases, the answer is yes. Non-contrast MRI images often provide enough detail for an accurate diagnosis. Second, request a kidney function test before the scan, usually a simple blood test called GFR. If your kidneys are weak, your doctor can consider safer alternatives. Third, let your doctor know if you've ever had unusual reactions after imaging with contrast in the past. These small details could spare you from a major complication. An MRI with contrast is like a powerful magnifying glass, revealing the tiniest details inside the body. But like any tool, it needs to be used at the right time in the right way. After 60, wisdom isn't about doing more tests, it's about doing smarter tests. And now, let's move on to the final test, a procedure that seems harmless because it requires no needles, no sedation, no contrast dye. The carotid artery ultrasound. Yet sometimes, this very test can become the ticket to an unnecessary surgery you never truly needed. Among the tests commonly ordered for adults over 60, the carotid ultrasound is often considered one of the safest. No needles, no anesthesia, no contrast dye.
You simply lie still as the doctor moves a probe around your neck, and the arteries appear clearly on the screen. It feels simple and risk-free, but it's this sense of harmlessness that can lead people into a cycle of unnecessary medical intervention, such as surgery or stenting. The carotid arteries are the main highways carrying oxygen-rich blood from the heart to the brain. As we age, plaque buildup is common, like mineral deposits in old pipes. Finding some plaque in people over 60 is very typical. The problem is, not all plaques are dangerous or need treatment. In many cases, managing blood pressure, cholesterol, and lifestyle is enough to keep them stable. However, when an ultrasound shows a narrowing of 50 to 60%, both patients and sometimes even doctors react with anxiety. The patient is often referred to a vascular surgeon, where the conversation quickly shifts toward removing the plaque or placing a stent. These are major procedures that carry real risks, including the possibility of a stroke during surgery itself.
A study published in the New England Journal of Medicine followed more than 3,000 older patients with moderate carotid narrowing, but no symptoms. The results showed surgery offered no clear advantage over medication and lifestyle changes. In fact, some patients experienced strokes as a direct complication of the surgery. Consider the story of Helen, an 82-year-old woman. She was in good health, but during a routine checkup, her doctor ordered a carotid ultrasound. The results showed 65% narrowing. Alarmed, her family pushed for surgery. But during the operation, Helen suffered a minor stroke, leaving her with weakness on one side of her body. She later admitted bitterly, "If only I had known that doing nothing might have been safer." So, is a carotid ultrasound useless? Absolutely not. For those with symptoms such as dizziness, blurred vision, weakness on one side, or a prior TIA, it's a valuable tool for diagnosis and timely treatment. But for people without symptoms, doing the test just to be safe can sometimes open the door to a cascade of risky interventions. If your doctor recommends a carotid ultrasound, ask, if the test shows narrowing, what will the treatment plan be? If the immediate answer is refer to surgery, think carefully, because in many cases, blood pressure medicine, statins, a healthy diet, light exercise, and quitting smoking can protect your heart and brain just as effectively as the surgeon's knife. We've just walked through 5 of the most common tests many people over 60 are likely to encounter: the CT scan with contrast dye, the treadmill stress test, endoscopy with sedation, MRI with gadolinium, and the carotid artery ultrasound. Each of these is a modern medical tool designed to detect disease and save lives.
Yet, when used at the wrong time or without careful consideration, they can also become the very spark that triggers a stroke. What you need to remember is not to avoid all these tests, but to understand that not every test is necessary for every person at every moment. After 60, your body is different. Your blood vessels are more fragile, your blood pressure harder to control, your heart and kidneys not as resilient as before. These changes make you more sensitive to things that might seem small: a simple injection, a short nap under anesthesia, or just a few minutes of exertion on a treadmill. This is not a call for you to distrust your doctor or refuse every test. On the contrary, it's a reminder that you have the right and the responsibility to ask questions. Whenever your doctor recommends a test, ask, is this truly necessary for me right now? Is there a safer option for someone my age? If the result comes back positive, how will the treatment plan actually change? Just those 3 simple questions can act like a shield, protecting you from risks you don't need. Remember, after 60, good health isn't only about catching disease early. It's also about avoiding unnecessary interventions that could do more harm than good. Sometimes wisdom means knowing when to say no.
when to wait, or when to choose a less invasive path. And if today's video has helped you feel more confident, more informed, or simply more cautious before your next checkup, hit the like button and share your thoughts in the comments below. Don't forget to subscribe and turn on the notification bell, because here we don't just talk about medicines or tests. We uncover the truths few people mention, the truths that can protect your health, your memory, and your independence in the precious years ahead.